P3. Pulse Peak Performance. The P3 is a pulse magnetic device that has been found to be effective in the treatment of horses. The P3 is sold through your veterinarian. For pulse peak performance for your horse, think P3.
Stuart Shoemaker. I'm an equine surgeon and lameness person at Idaho Equine Hospital here in Nampa, Idaho. I've been asked today to talk to you a little bit about some alternative therapies in the P3 electromagnetic therapy device. As we look at sports medicine in the horse and the advent of an increasing competitive nature of the events that these performance horses go through, we've had a number of interesting developments over time. First of all, the intensity at which these animals are trained and the severity of the workload that they have has created an entirely new set of athletic problems that we see. As we look at competitive horses in all disciplines, whether they be Western performance or English performance, we see a consistent reoccurrence of injuries. It's interesting how the bulk of those injuries seem to be fatigue related. And as these fatigue-related injuries occur, it becomes apparent as the person that's working on those horses that we've got to do some things to try to improve and increase the amount of balance that we have for these horses. When I say balance, I mean an overall combination of physical and mental preparedness of that athlete to do their specific job. So in the Western performance horse, we are in an unenviable position of having to work on horses at a really early age. These horses start into training prior to the time that their skeletons have been completely developed, and so we see a different set of injuries associated with those horses than we do with many of the other older disciplines, such as dressage or hunter jumper or competitive stadium jumping, where the horses start into those disciplines at a much older age. As training methods have improved, as tack has improved, shoeing methods are getting better, nutritional programs are getting better, everybody's on the same page there. All of the trainers, all of the owners, all of the veterinarians, we're all looking for a competitive advantage. At this juncture, that seems to be coming in the form of adjunctive therapies. Well, adjunctive therapies are things that we add to our traditional training programs to give us that competitive advantage, to make those horses the best that they can possibly be under the circumstances. Adjunctive therapies are probably the largest growing segment of the equine sports medicine world today. They range from chiropractic manipulations to ice machines to magnetic blankets. All of these things are considered to be an adjunct to help your horse reach his optimum performance. How do you determine whether those things are working or not? That's always going to be a challenge, and I think we'll forever be trying to get better parameters by which we make that decision as to whether or not those things are working. However, we have had the opportunity to evaluate the P3 electromagnetic device, and one of the distinct advantages about this machine is you can actually see it doing its job. Not only are you completely convinced that you're getting the targeted muscles affected by the fact that they contract and relax in front of your eyes, but you can see the patients relax. You can see the response of the patients as they become more relaxed, as the muscle starts to desensitize, as they get less contraction of the muscle belly. Those patients relax, they become more comfortable, and then the real proof of the effectiveness of the therapy is when they go back, they rest, they recover, they eat better, and then the next day, they are more flexible, they have better range of motion, they ride better, they ride like they do after they've had 2 or 3 days off. That's a huge advantage, especially when you're in a highly competitive market like the Western performance horse world, where those horses are getting ridden 6, maybe 7 days a week at times. Over the last several years, we've made an attempt to try to get an overall sports medicine approach to our equine athletes at Idaho Equine Hospital. And one of the things that we've recognized is that it's important to try to get as much adjunctive therapy involved in this as we possibly can. We really believe that the prevention of sports injuries is probably the most important thing that we can try to do. The sports injuries are going to occur. We're going to be there to treat those patients when they get injured, but if we can play a role in preventing them from getting injured and helping trainers and owners keep their horses sound throughout the show year, that would be a huge advantage. The P3 electromagnetic device is a very interesting piece of equipment that we have utilized very successfully in managing patients with muscle soreness. In addition to muscle soreness, we've used it in patients that have had pulls and tears, strains of large muscle groups, and even smaller muscle groups in an attempt to speed their recovery and make them more comfortable during their recovery process. It has allowed us to completely revamp the way we look at back soreness, overall body soreness in horses that are in intense exercise programs, and it's been very beneficial in helping the young horse through those critical periods where, as they start to try to become physically fit, as their training programs are ramped up to make them more capable of doing the fine motor skills that are necessary for their specific events, this really helps those horses go back, recover, maintain their flexibility, their range of motion, and they rest and recover much better at the end of that program. For those of you that know me, one of the things that I think is important to recognize that is I'm a skeptic. I'm a skeptic at heart, and I look at things with a critical eye because I really take it seriously that we do no harm to our patients. And so the therapies that we recommend to our clients and for our patients, for me, have to be tried and tested and have some distinct benefit for the patients. Otherwise, I don't think they're good economic investments for my clients. One real advantage to the P3 machine has been I have done number of tests in an attempt to determine whether or not there is any detrimental side effects. This is a non-invasive, completely harmless therapy for patients that has a tremendous opportunity for benefit. I think that's really important for me and for you as a potential consumer to recognize that there's really no downside to this therapy. That's really important. We've seen some really unique things about therapy with the P3 machine. First of all, there are horses that have no real muscle pain. And in those patients, really all they're getting is a great deep tissue massage. In patients that actually have some muscular discomfort and some pain, initially you'll see them react. You'll see them move away from the machine. As the muscle becomes desensitized, as they soften that muscle group, then the muscle starts to contract in a more normal fashion. The horses relax and they go back to having a more normal response to the therapy. I think that's a really important concept. We've actually tried to use it a little in a diagnostic capacity where we look at, can we determine areas of soreness by applying the P3 machine and seeing what the horse's response is? Yeah, I actually think we can. Now, it's not 100%, and I don't want to portray the idea that that's how you diagnose all muscle problems, but it is interesting how many horses respond to the P3 differently when they're body sore than they do if you put it on a horse that's not in athletic training, that doesn't have any muscular soreness. It's a really nice comparison. We've applied the P3 in a number of different areas. We've used it as a preventative, where those patients are being treated on a daily basis during that training episode. We've used it in patients that have had obvious muscle pain and injuries as diagnosed by ultrasound. We've used it in places where we saw horses change their gait and shorten up their stride length as a result of muscular contraction and discomfort. And in every one of those situations, we've had very positive results from the use of the P3 machine. In an overall health and training sports medicine program for the equine athlete, the P3 would be an extremely valuable adjunctive therapy for any training program, any veterinary practice that sees and treats a lot of performance horses, even the private owner that has a large number of horses that are in training. We've been extremely pleased with this tool for managing muscle and soft tissue disease.